have any toys? Do you have any toys?
Yeah.
You've been looking good. What's this?
Penguin.
Good job.
I'm the dad.
What's this?
Daddy me.
Daddy and you.
No me?
No you.
Huh?
Big eyes. Yeah.
And I'm really big.
You are really big.
Yeah.
Okay.
I'm really tiny like this.
Really tiny like this.
Yeah.
Okay.
I've been worried. I thought she has leukemia because we've been in hospital and they were doing loads and loads of tests. Apart from the blood test, they've done x-rays, they've done ophthalmology checks, they've done hearing tests, and we didn't know why. Even the ophthalmology doctor was surprised why a 5 weeks old baby is coming for checkups, because we don't know for what.
There is your head over there.
No.
And there's Daddy.
No.
Is it not Daddy?
No, it's mommy.
I didn't know if she's going to live tomorrow on a second day. Very worried. We've expected then chemotherapy, and at that time, without any knowledge, chemotherapy, cancer, leukemia, for me it's death.
It's essentially when children are born without a working immune system because of a genetic mutation in their DNA. And without a working immune system, these children are extremely vulnerable to serious infections. And without treatment, most of these patients would die before their first birthday. It's essentially a gutted out AIDS virus. It's the HIV virus, but it's had a lot of the genes taken out so that it doesn't cause any disease anymore. And then we package in the genes that we want to for the condition that we're treating. And the virus is very specialized in being able to get into immune cells and blood stem cells, but also it has an enzyme which allows it to integrate the DNA, so to put the DNA that we want to put into the patient's cells.
Go. Sarah, I said one by one. I said one by one.
Hi.
Prior to gene therapy, these patients would have been on many medications to prevent infections, weekly injections and weekly infusions of immunoglobulin. They would have been at home, isolated. And then pretty shortly after the gene therapy, actually, we're able to take off those medications. They can stop the injections, they can stop their weekly infusions, and then eventually start to socialize with other children, go to school, go out and lead a normal life. So the impact on the family is phenomenal.
Why she don't have hair?
Because that's Daddy with no hair.
Who's that?
Ade.
Here.
She's your friend.
Here.
Do you want to take a picture of Mommy?
No, that's him.
How about the lady?
Bone marrow transplants can be used to treat patients with immune deficiency, and if you have a good donor for transplant, then the outcomes can be very good. But the procedure itself comes with some inherent complications which gene therapy doesn't. So in gene therapy, because we use the patient's own cells, there's no risk of rejection and there's no risk of a fight between the patient's own cells and the cells that they're receiving, which also means that we can then use less chemotherapy for the procedure, and the patients don't have to be on immune suppressive treatment to try and prevent rejection or graft versus host disease.
6. 1, 2, 3, 4, 5, 6. 4.
1, 2, 3, 4, 5.
4. Don't cheat. Don't cheat.
Any Any disease that can be treated with a bone marrow transplant can potentially be treated with a gene therapy if we know the gene involved. And that's exactly what's happened in this field. So 20 years ago when gene therapy started, it started treating immune deficiency disorders like the one we're talking about today. But since then it's actually been used to treat 6 or 7 immune deficiency disorders, but also metabolic conditions, hematological conditions.
It's not a cure. It's not 100%. It's just a treatment for now.